Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Hematuria. The hematuria can be of two types. One, glomerular causes of hematuria. Second, there is urological causes of hematuria. In glomerular causes of hematuria, the cause is in glomeruli. So in glomerular causes of hematuria, you will see that dysmorphic or crenated RBCs will be seen in the urine. Even one dysmorphic RBC is very important. Second, there can be acanthocytes may be present. Acanthocytes are present in more than 5% of cases. If acanthocytes are present in more than 5% of cases, then this will suggest the presence of glomerular source of hematuria. RBC casts are also present in glomerular hematuria. Then we have urological causes of hematuria. In urological causes of hematuria, it can occur due to ureter, bladder and urethra. One more important thing in glomerular causes of hematuria is in glomerular causes of hematuria, even concomitant presence of concomitant proteinuria is common. Concomitant proteinuria of 1 gram per day is common in glomerular hematuria. Then in non-urological or also called as non-glomerular hematuria, in this there is isomorphic urinary erythrocytes may be seen. Isomorphic, that is good normal urinary erythrocytes are seen. There are no RBC casts in the urological or non-glomerular hematuria. There is no proteinuria is also seen in urological or non-glomerular hematuria.
thank you and thank you for watching.